Risk factors? I don't think I have any.
My mother didn't either, and they found something in her mammogram.
Wow. We better go see the doctor.
I don't really have a doctor. It's too hard to communicate with them.
Remember how earlier we talked about how important it is to find breast cancer early? When it is still small and has not spread? One of the difficulties of finding cancer at this early stage is that there are usually no symptoms. You don't see anything different. Your breasts look the same. You don't feel different. There is no pain. You may not feel any lumps. So, how do doctors find breast cancer at this stage? Fortunately for us, there are ways to detect breast cancer at its early stages through breast cancer screening. But for breast cancer screening to work, each of us, each woman, needs to take action. It's our bodies, our responsibility, not our doctors.
That's right. Each woman needs to take responsibility for her own body. Each woman needs to take action. With breast cancer, action means following 3 important steps: mammography, clinical breast examination, and awareness of your own breast health. A yearly mammogram is an X-ray of the breast that can find very small breast cancers, often before a woman or her doctor would be able to feel it. During a mammogram, the breast is pressed between 2 plates to flatten and spread the tissue. This makes it easier for doctors to see if there is cancer. Some women find this uncomfortable and hesitate to go for an annual mammogram. But the test is very important and could save your life. Doctors recommend that you should have a mammogram every year once you have reached 40 years of age. a yearly clinical breast examination, or CBE, is an examination of the breast by a physician or other trained healthcare professional. The clinical breast examination is an important part of a thorough breast cancer screening. This is because physicians and other trained healthcare providers can find lumps that might be cancer. But sometimes lumps or other changes can still be missed by clinical breast examinations. If you are over 40 years of age, you should have a clinical breast exam every year. The best time to have the exam is just before your annual mammogram. If you are younger than age 40, a clinical breast examination at least once every 2 or 3 years is still a good idea. Breast health awareness means being aware of or knowing how your breasts normally look and feel. This is important for all women at any age, young or old.
I check myself in the shower now and then. No lumps. Isn't that good enough?
The answer to this question is no. Being aware of your breast is important to find breast cancer as early as possible, when it first starts, when it is easiest to treat. You must go for a routine yearly mammogram and clinical breast exam, and being aware of your own breast health. All three are important for women, ages 40 years and older.